Now everybody has a skincare routine with like different kinds of serums, different kinds of lotions, moisturizers, and influencers are recommending it like as if it is a prescribed drug.
Fad about Korean products, which is getting very popular. Korean products are for Korean because their skin is very thin.
Zero alcohol, zero smoking is what is best as per current studies.
So for Indian skin, an SPF of 30 is more than enough.
There is a market wherein everybody sells collagen supplements. How true are these supplements? Do they actually help you?
I have seen a young girl who was earning, say, about 40,000, but investing 50 to 60,000 for IV glutathione injection and skin cleanings.
Hi, in this episode, my guest is Dr. Bindya. She is a board certified dermatologist, esthetician, and a cosmetologist. We discuss science and clinically approved protocols to improve your skin health. We also discuss about the myths around skincare and also usage of sunscreen and other products on your skin as well. This episode also provides you actionable steps and protocols on how you can take care of your skin. Happy watching. For today's show, we have Dr. Bindya with us. Ma'am is a board certified dermatologist. And today, thank you, ma'am, for taking this time out to be with us here and, help us understand about this amazing organ called the skin. So the skin is this amazing, vast organ, but most people don't even know it or call it as an organ, but it kind of covers the entire surface of our body. And it is such a wonderful organ that it encapsulates the entire body, offers protection, and does so many other functions. So today I'd like to go in depth with you and discuss about this amazing organ called the skin. So ma'am, although the skin has so many functions, but what most people are really worried about is just the appearance of the skin. So today I'd like to kind of understand what is the relationship between stress and skin and how does that actually affect?
So, Sharanya, I'm very grateful for you to calling it as the organ. Most people do not give it the due respect that it is a large organ. It's the largest organ in our body. People understand when we say heart is pumping, brain is not functioning, but when we say skin is not functioning, they fail to understand it. But it's the largest organ, covering and doing lot more function like temperature regulation. We are sweating out and it regulates the temperature. It is holding to the fluid and it is a barrier. It is not just a physical barrier but also an immunological barrier. Above all, it is an endocrine organ. It is producing so much of hormones there. And likewise, it is under the influence of so many other factors as well. So, as you brought about what is stress leading, what is the impact of stress on the skin? Stress is there every single day. Everybody is experiencing it, and every minute they are experiencing it. There is, for any disease, there is a first hit theory and a second hit thing. The first hit is a genetic problem, and the second is our lifestyle, wherein stress comes into the picture. So there are a lot of genetic skin conditions like psoriasis, vitiligo, male pattern hair loss, where stress is increasing it. Then stress itself increases lot of skin conditions like inflammatory skin conditions like acne, lupus, which gets worsened with stress.
Right. Ma'am, so I want to basically continue this and understand. Now, when people talk about skin, right, it's just about how good I'm looking or how the appearance of the skin is. I want to have a spotless skin. Now, does stress go ahead and increase your aging or increase, the way your skin is responding as you age? Because now we see a lot of Bollywood actors, they have flawless skin. Now, everybody wants that skin. So, what is your, take on that?
So stress definitely is going to increase the aging process. So stress, as I told you, releases body hormonal changes. It causes releases steroids, which makes the weight gain happen, and other hormonal disruption is happening because of that. And then it breaks down the collagen by triggering of MMPs in our body. So aging process is going to get worsened. Skin is going to become more thin, produces less hyaluronic acid. So definitely stress is an important factor for the aging process.
Right. Ma'am, now that you said, about hyaluronic acid and the MNPs and all of that, Can you tell us what MNPs are exactly and how they actually help our skin?
So it's an enzyme which body produces. MMPs are enzyme, and it has a role to play to break down collagen and many other molecules. But when it gets exaggerated or fast processed because of stress, then the collagen breakdown happens faster. Collagen is like a foundation or a building block of the skin. So if
Right.
that is broken down, the top layer of the skin is going to start collapsing.
So now, since you brought up collagen, there is a market wherein everybody sells collagen supplements. How true are these supplements? Do they actually help you? Or is it just like you're taking, calcium Zandos was there back in the day? Is it, what is it?
It's a gray area. It is
Okay.
not backed by evidence
Hmm.
yet, but there's a lot of interest going into it.
Hmm.
So until unless there is a good double-blinded randomized control trials, I still tell my clients that it's a gray area. You want to take it, you can take it. It is going to be just broken down by the acids in the stomach,
Yeah.
and may not do any harm, but still a gray area.
So it would rather just to summarize it to say like you're basically taking in something which you may not get the benefits of.
Yeah, yeah,
But
true.
you are it's also safe because it is not causing any known side effects as of now.
As of now,
But
yeah.
we also don't know about it because it's not studied enough.
Yes. So until unless there is a good evidence, scientific evidence, as a prescription, it may not be there, but the market is definitely flooded. People who have taken it, they're vouching for it, and it's not available as a single molecule. Many a times it's in combination with other things like glutathione or a lot of other antioxidant, which is giving the benefit. We still don't know. It's still
Correct.
to be explored area, is what I would
Correct.
say.
Okay. Understood, ma'am. So, now what effect does, temperature have on your skin? Because, suddenly we see that we go to a cold temperature, our skin is doing much better. And when we reach humidity, there are some changes in it. And for somebody who's like traveling or, in both environment, how does that temperature actually affect your skin?
So there's skin can regulate, but if it is to be subjected to a rapid changes, today you're here in Bangalore, then tomorrow you're traveling to Chennai, then you're traveling to a hill station Manali where it is cold, then it cannot adjust so quickly. And then the other thing depends upon what are their background pre-existing conditions. Do they have atopic dermatitis? Do they have psoriasis? That plays a role. But what do we have in control? Whether what kind of moisturizer we are applying, what skincare routine we are following, how much of hydration we are doing, that is under our control. Then you can keep it, you can protect it from these drastic changes.
Ma'am, now that you brought up, skincare routines and what kind of moisturizers and all of that, this has also become a huge area of concern wherein now, 5 years back, just or pre-COVID itself, if I would say, we did not have like a skincare routine. We only probably, the celebrities did it and things like that. But now everybody has a skincare routine with like different kinds of serums, different kinds of lotions, moisturizers. And influencers are recommending it like as if it is a prescribed drug. What is it and what is this whole thing? Do we need it actually?
Skincare definitely required, but we have, as dermatologists, I think most of my colleagues also will agree, we are reached a point wherein we are telling patients to take breaks, holidays from skincare regimens, because we are seeing they are overdoing it. And coming to the point of influencers who are doing it, we have to take it with a pinch of salt. They are selling something to us. We are the end points when we are looking at
Right. So my question is this skincare routine, like for example, it starts with a toner, then there's a vitamin C serum, hyaluronic acid serum. Are these supposed to be self-prescribed?
no, definitely not self-prescribed. It has to be after analyzing what the skin type is. But what everybody can definitely do or should be doing is using a gentle cleanser, a moisturizer, a sunscreen. This is mandatory for everybody. Again, at bedtime, putting on a moisturizer is mandatory. And then we need to build it upon what their skin concerns are, what is their pre-existing skin condition. Based on that, it has to be customized, tailor-made. Not that one regimen is for everybody, or one the fad about Korean products, which is getting very popular. Korean products are for Korean because their skin is very thin. So we see Indians using it. We are in a humid environment and we end up using it, having breakouts and not suiting to our skin. So it's not something which is one thing which you can take and it's for the whole population.
Have you seen like any cases in your practice that, they have just started using these serums without any prescription and how their skin has kind of gotten more damaged than better?
I think it's a routine challenge which we face. Again, there is one set of people who buy the OTC products, which their trusted pharmacist is just handing over for their skin problems. That is a huge issue, huge problem which we encounter. Second is when they are overdoing their skin regimens. They're using AHA, BHAs, they're using retinol. What they're forgetting is they all have a synergistic action. Everything is exfoliating. Over exfoliation, then they are going to their parlor regular facial procedure, further exfoliation. Then they're out in the sunlight, not applying their sunscreen regularly, repeating the sunscreen. We are encountering huge number of problems. Our OPD, I would say, is definitely increasing with this kind of cases.
Right. So when it comes to moisturizer and when it comes to skin cleansing, now when we say skin cleansing, right, people cleanse, I know people who cleanse like 3 times a day, 4 times a day. What is the right thing to do when it comes to skin cleansing?
So 2 times a day is what is sufficient. More than that, you're just disrupting the skin barrier, destroying the good microbe which is there on the skin, inviting newer infections. The bacteria is there, the fungus is there on our skin to prevent any other outside attack from bacteria or fungus, which will lead to secondary bacterial infections and also over cleansing, definitely a no. And the other knowledge about what are cleansers, what are face wash. Cleansers are something which can be used anywhere. It doesn't require water, and they are quite gentle, can remove the dirt, oil secretions, other impurities, and at the same time not destroy the bacteria and the barrier. Face washes require water and they will be a little more deeper level. They are working, taking off the oil secretion, meant for more acne prone skin, somebody who is in more polluted areas, require face washes.
Okay. And with when I was in college or anything, we had a very, very simple routine. That is, there were no so many face washes. Like right now, there is a salicylic acid face wash, then there is an AHA face wash, and then people have so many different kinds of face washes are available. Should they actually be using it? Because what I would use is I would just use, even till today, just regular water and a mild cleanser and move on with my day with just a moisturizer and maybe a sunscreen. But today there is like a whole routine itself. And sometimes we see that, people are kind of switching these things, morning I do this, evening I do that. How beneficial or inefficient are these?
So cleansers, they can be, again, they depending upon the problem of the patient, they can be added. The ingredients can be added, like salicylic acid can be added, lactic acid can be added, kojic acid can be added to the face wash. But this should be a prescription thing.
Right.
It's not one purchase which you can, a client can do it on their own. And overdoing these acids, and then there is in their regimens also they're adding kojic acid, niacinamide, arbutin. So again there is over exfoliation, the barrier disruption which we are seeing. So definitely it should be kept to a gentle cleansers. And we are in Bangalore where the weather is almost like an AC temperature, very dry weather. Further dryness is created by using of all these strong acid based face wash.
Got it. And then moving on to whatever you said, just to sum up, right? So stress has an impact, and definitely all these serums should not be and cannot be used like an over the counter thing. It is
Yes.
as bad as us taking, you know, any kind of antibiotics over this counter.
Yes,
It is the same
yes.
thing that we are doing to our skin over a period of time,
Yes,
right?
yes.
And then now also we see that, you know, there is this whole concept of you only live once. So people have started getting into, you know, the number of people drinking, smoking, and the third most important thing that I see is vaping. Because smoking at least had like a kind of a societal thing to it, that it smells bad and all of that. But now these three things have become an increased thing. That means people start from the age of 18 and, you know, continue on till whatever. How does that impact the skin?
So, alcohol definitely, it has the dehydration and with the internal changes which causes liver changes, it causes, and then skin shows up the changes. Acne gets worse. Any inflammatory condition gets. What is okay? What is within the um, uh, permissible limits, which is not impacting their health? That awareness has to be reached out to.
I'm sure. Is it safe to say that zero alcohol, zero smoking is what is best as per current studies, or do you still say that there are permissible limits?
Yeah, I mean, CDC itself gives a guidelines that there is a permissible limit for alcohol. So, one drink per day for women and two drinks for men, and less than 7 times. So when we tell this, okay, is 4 5 drinks at a time is okay. So that's binge drinking is also not okay.
Okay.
So there is a guidelines which has been laid down for what is allowed and what will not have an impact. Smoking, I don't think so. Any guideline. I mean, it's a no. It's
Okay.
definitely has more impact.
Okay. So smoking definitely ages the skin, because one thing is the smoke itself. I think when somebody goes through surgery or they have a suture, they explicitly tell
yes.
them that please do not smoke because it will delay your wound
Wound
healing.
healing, yes, yes.
So I'm sure that will also have like a great effect on how your skin ages.
Ages, yes.
So
Aging is increase, and pigmentation, lip pigmentation, it's so they bothersome for them, but they continue to smoke. And again, all the inflammatory conditions get worse with smoking.
ma'am, and then next when it comes to hydration, because you were mentioning about moisturizer, like
I think we've that vaping part of it,
Yeah.
So it's like since it's available, people think it's safe. It's an alternative to
Smoking.
in a safer form, but it's not. It gives the same effect with additional problems. So we see, like, we do a lot of procedure. They come with the vaping equipment or instrument with them and forget to tell us. There are burns incidents because they're again lithium batteries which are there within that, and allergic contact dermatitis which we see with vaping instruments also, and they're not open to discussing with us.
Yeah.
Or they think it is safe, so they don't want
Yeah.
to mention to us.
So I think earlier the questionnaire used to be, are you an alcoholic? Are you a smoker?
Yes,
Now there's
yes,
a third
yes.
addition
Yes.
to the history taking, that are you also vaping?
Vaping, yes.
Yeah.
Definitely.
And next, moving on to like the hydration part of the skin, right? Now, hydration also, like most people think that, is there like a proven study to show that the more water you drink, the more hydrated your skin is? Or it like hydration, if you're an athlete, matters to you, but if you're not an athlete, is there any change in that, and how does it actually?
So hydration definitely is important, but yeah, we are seeing overhydration also. They're only drinking water, but it should be ideally with electrolytes. So if you're taking your buttermilk, you're taking your tender coconut water, and fruits which are rich in fluids, that is better than only drinking 4 to 5 liters of water. So then it is entering the skin, getting locked into the skin. Otherwise, the electrolytes are not there, they just go into the urine, and we see a lot of hyponatremias because of overhydration.
Okay. And ma'am, when it comes to moisturizer, what kind should one pick? Because now, if you go to the market, you get like a variety. Like, I'm also confused. You get like snail mucin, then you get, like you said, moisturizers with salicylic acid, just moisturizers with hyaluronic acid. There are so many. How should one pick up a moisturizer? Is it based on their skin type? And what is it actually?
So, two important component to moisturizer. One is humectants, and another one is a lipid binding molecule. Humectants are like water magnets. It will go into the skin and pull the water and retain it. Then the lipid binding ingredients like ceramides, hyaluronic acid, they are going to bind these cells together and hold on to the water which these humectants have
Right.
pulled in. So both these components should be there when you're checking. Then it depends again on what kind of skin you are. Whether you have a oily skin, extremely dry skin, a dry skin, regular use. Based on that, it has to be decided. And then the economics of it, because large areas are there and pre-existing condition like an atopic dermatitis patient cannot be without moisturizer.
Yeah.
So they're going to use it in large quantities for long term usage. So economical whatever is available, like glycerin and liquid paraffin. This is a humectant, and it's called a poor man's moisturizer.
It's like your Aquaphor and Vaseline's one.
Yeah, Vaseline's, which is main ingredient is liquid paraffin, your petroleum jelly. These are definitely going to protect the skin, prevent it from losing the water, hold the water what the skin cells is picking up. The addition of the newer molecules like the ceramides and hyaluronic acid, which will increase the period of how next application of moisturizer gets prolonged. Then there you can add agents which are going to be an exfoliant like salicylic acid, lactic acid, which again hydrates and exfoliates at the same time. So this additions can be done because many of them are tanning. They want something to remove this tan and they want one application product. So detanning agents can be added to it.
Right. Then since you mentioned tanning, then let's move on to like sunscreens. Because honestly, like I think I had come to you with a problem too, that I was using this Korean based sunscreen and then eventually came to meet you and then realized that it was not the right kind of option for me. Now, just like that, now we get like so many varieties. We get like SPF varieties, and then there is like active ingredients in it, and also there is so many things that kind of define a sunscreen now. There are sticks and there are balms and there are creams and
Sprays
are available. What is the best sunscreen? Is it like there's a difference between chemical, mineral, so many things?
Yes.
So can you like break it down for us so that like
So for Indian skin, an SPF of 30 is more than enough. It's proven with research, with evidence. The UV light has been applied, phototherapy units which we have, so skin has been tested in such scientific level, and it's proven beyond doubt that 30 SPF is more than enough. So buying a 50 SPF, 80 SPF, 100 SPF which is available is useless. Your money is just going on to that increased SPF values, and it with no benefit, and it gives a false confidence that I'm applying 100 SPF, so quantity can be less, or I don't have to reapply. So which is not true. It has to be reapplied. Any sunscreen needs to be reapplied after 5 to 6 hours.
okay.
Now, the second part of it, what you were asking, what is an ideal ingredient in a sunscreen? So we have physical sunscreen and chemical sunscreen.
Right.
Physical sunscreen is like our zinc oxide and titanium dioxide. If you've seen the olden cricketers who were using
the
whitish
patch, and now I think even some surfers have this whitish patch on their skin.
So it's like carrying an umbrella.
Yeah.
As long as it's on the skin, it is 100% protection of physical sunscreen. But people don't like it. It's white casting is there. Most companies or research is going on how to reduce this casting effect of it. But it's one of the safest one. And that's the only thing which is recommended for anybody who is less than 16 years.
Okay.
Because skin is an organ which absorbs whatever you're applying. So we are worried about hormonal disruptions and things. So
great. And thank you. Like you actually brought this up because I see a lot of teenage kids now because of, Instagram and everything. all of them have like a huge bucket of skincare.
Yes, true.
They all use vitamin C. Should this be permitted in children at all?
Yeah, permission is a big
No,
question
in the
mark
sense
from
of is it
like
safe?
yeah, it definitely is not safe. Like I'm saying, it is an organ. We are looking at drug delivery system through skin. So you can apply your nutrients and reach things. So many drugs are available, which are available as a patch.
Patch, yeah.
Pain relief patches are available. So when it's an organ which can absorb, then daily in and out you're applying so much of chemicals in terms of what, even if the safe
Yeah.
serums, vitamin C serums, they're not coming just as a raw molecule, right?
Yeah.
They're coming with vehicles,
Yeah.
which can have impact. One of the biggest worry is hormonal disruptions, the increase in PCOS patients, which we are seeing, early precocious puberty, whether these are the reasons, we really have to look into. And
Right.
I mean,
It's,
when the
it's really
governmental ban,
shocking because there is no like a blanket ban from
yes,
CDC or FDA or anything.
yes,
So these are over the counter.
yes.
So, ma'am, also want to say, is the concentration of these drugs so high that it can change?
But over a period of time, it's on a daily basis, somebody is using over. Now the awareness is there. Like mother is using, so the child also wants to use. They're looking at their parents, they know that they have to do the sunscreen usage.
Yeah.
They have a part knowledge which is through social media. It's not a complete knowledge.
Right.
So they're buying
So it
over
is
the counter
definitely
sunscreens.
safe to say that for kids, nothing but a mineral sunscreen, and
Yes.
ideally recommended that you get it from a dermatologist.
I mean, even if you're not meeting a dermatologist, what should be approved for them is a moisturizer and a sunscreen, which should be a mineral sunscreen.
And that too, just SPF 30 is more than enough.
More than enough, yeah. Anything coming above, you can afford to buy it, no harm. But
that is
30
what
is
is more than
for
enough.
Indian children, yeah, Indian
Okay.
skin.
And definitely a no to all of these serums and then these 10-step skin procedures.
Definitely not.
Just a non-comedogenic moisturizer plus, your sunscreen.
Yes.
Ma'am, so now since we spoke about, cosmetics and all of that, how do, we spoke about, serums and over-the-counter product. Now, how do cosmetics actually affect the skin? Should it be an everyday application thing? Because now it used to actually be a trend in the West, but now nobody steps out without makeup. And there are a lot of fragrances in this makeup. And how does that actually affect the skin? Is it safe at all?
So once you have prepared your skin, you have created a barrier with your moisturizer sunscreen, then when you put on your makeup, it's okay. It can be, it's allowed to be used. And if it is heavy with fragrances, yes, it can cause a lot of problem. But a mild fragrance, mild scented fragrance, and when you're picking up, if you can look out for artificially prepared fragrances or synthetically prepared fragrances and avoid those things, something which has more of these essential oils, that is a better pick for the side effects of it.
Right.
So the other set of cosmetics, again, your perfumes, deos, which I mean we all have to use on a regular basis, causes a lot of irritant contact dermatitis, allergic contact dermatitis, and so picking up these essential oils, which is better than the artificially prepared fragrance.
Right. Ma'am, and next coming to, hair and also skin, lot of people use home remedies. For example, applying onion juice to your scalp is said to kind of increase your hair growth, and then applying any other home remedy for
I'll give
detanning.
you the list of things: rice water cleansing, rosemary oil preparation, garlic pounded and applied on acne, pounded and applied onto bald patches. So you cannot imagine the crazy things people can do. But so there's something from Indian Association of Dermatologists which is put out as an education leaflet, wherein there is no toners to be applied, no scrubs, no these home remedies to be done. So they are all active ingredients. Lemon, you're getting your citric acid. Curd, you're getting your lactic acid. How much you're applying, what is the strength of it, you don't know when you're doing it as a home remedies. So better not to be done, and there is a guidelines which has been, or a patient education information which is available on our dermatology association platforms also.
And so it is a big no-no.
It's a big no. Yes.
Okay. So people should just stop doing this. But what should they do if they have hair fall and bad skin?
When what they can do is definitely concentrate on their diet. That is a huge cause, or a major cause for hair loss. And hair oiling is something which is okay to do. They should be doing it, and they should be doing it onto the hair. It's a grooming technique, smoothens conditions there. Or coconut milk extracts also is okay to do. Anything else addition to it, like aloe vera, we see a lot of people, egg whites being applied. It has different impacts. Like aloe vera is different at the root, it concentration is different in the middle, and scalp irritation can happen. So it's a big no to add anything else other than coconut oil. That too, with if they are facing some problems like dandruff or acne, then it better to be avoided.
Right. Now, since you brought up dandruff and acne and all of that, a lot of people suffer with dry scalp. And the minute, they see a dry scalp, the only go-to is, okay, we should oil it.
Yes.
And this dry scalp could be so many more things, like, it could be psoriasis, it could be so many things. Can you just explain about what is this dry scalp? What are those conditions? How should someone approach it?
So, just like how your skin is, if it is a dry variety of your skin on your legs, face, similarly is your scalp. Scalp, after all, is a skin. It also is going to be dry. That's going to be the nature of the next immediate thing when they start seeing some dry flakes is they'll go and buy a OTC product. I'm sorry to say OTC, it's not even an OTC, but provided as an OTC is a ketoconazole shampoos and everything. Then they further dry up the scalp. The side effect of ketoconazole is drying. Scalp gets dry, hair gets dry, and then they come back with a very sensitive scalp. This was something which we were never discussing, but now in the limelight, that how skin can become sensitive, scalp sensitivity also is there. So they shouldn't be doing that. Oh, if they are in doubt, it's okay. I would say it's safer to apply a coconut oil. If they are still in doubt before they come and see a dermatologist, it's okay for them to pick up a Head and Shoulders.
Anti-dandruff shampoo.
Yeah, like an anti-dandruff shampoo which has selenium and these kind of ingredients. It is okay for them to do it. But it needs an examination definitely, whether it is a dry scalp, whether it is dandruff, or whether they're dealing with psoriasis itself.
Right. Ma'am, a lot of people deal with psoriasis, right? And somehow, at least when it comes to the skin, they, at least because it is visible, they have to get it treated, they come and get it treated. But when it comes to the scalp, they will try a lot more home remedies before they come to you. Is that true? And what are the challenges you see when they come with such kind of things?
Scalp psoriasis or psoriasis as such, is considered just a skin problem, but it's not true. It is a metabolic disorder. It has a lot of internal impact. They can be diabetic, they can be lipid profiles which are altered with these patients. NASH, non-alcoholic steatohepatitis, arthritis, which is so they're just roaming around with one patch of this psoriatic patch on the scalp, but moving around with all the other doctors and never identified that this patch was the actual problem. And when we identify and correlate this, we can give them good treatment with oral medications or things, and they're relieved. So do not ignore these patches which are there on the scalp. Don't think that it's just dandruff and try to self-medicate for a long time before the whole immune process starts affecting the other organ.
So how does the gut microbiome actually affect the skin? Does it have any function? Should people be worried about it? And
there's huge research, huge information which is coming out. We are also using a lot of probiotics which we weren't using earlier in our management. So it's bi-directional. What is the gut health? is what the skin health also is. The gut microbiome is good, the skin microbiome is good.
Right.
So B12 absorption improves, so skin gets brighter and glowing. Then the bacterial infection comes down. So acne, atopic dermatitis, rosacea. So in urtic areas, many itchy hives which patients come to us, they get relieved with these probiotic treatments. So gut health definitely.
Now, when you say probiotic treatments, like you said, it's definitely important, and it's picking up. And now, so should they take it again over the counter?
We are deviating from our natural lifestyle or what traditionally we were doing,
Yeah.
So we would eat our idlis, dosas, which are fermented, a lot of curd. And traditionally, if there is remaining rice, it would be fermented overnight and drank. But now we are,
like the kanji.
kanji. And now we are going for pre-prepared products like kombuchas and everything. So when you deviate, then the whole gut is going to get affected.
Right.
But how many children are not eating breakfast? They are skipping the breakfast. But the first breakfast, the break the fast should have a fermented product. So the gut health, absolutely essential, and it can be met at home with natural remedies. That's where the home remedies should come into the picture.
Right. And then next, moving on to, hair loss itself. I recently made a piece of content on my page wherein we spoke about, the PP405 molecule, which UCLA has come up with for hair loss itself. There was a lot of, action and activity on it that, please tell us, and how do we use this? How do we, control our hair fall? So when it comes to such kind of thing, and now we're seeing that female pattern baldness, male pattern baldness, patchy alopecia, everything is on the rise.
Rise, definitely.
And what could be the cause, and how should we actually minimize it, and what to do about it?
So, male pattern, female pattern, definitely we are seeing increase. Stress could be the cause. With female pattern hair loss, the hormone disruptors, again with the food sources, a lot of pesticides, insecticides, hormones being injected into it. Milk also we are thinking of, the animal is injected with a lot of hormones. Plastics, microplastics has been found in blood of men. That could be one of the hormone disruptors leading to early presentation or increased presentation of male. We are seeing as early as a 13-year-old, 14-year-old, as soon as they hit puberty and they're showing the patterned hair loss. So this could be the one of the causes, and of course stress, lifestyle, which is adding to the problem.
Ma'am, and even during stress patterns, like we see, like you said, stress would add like pregnancy and exam stress or work stress. Suddenly, there is an increase in the hair fall. Now, would that hair fall, what has taken place during that stress, does that reset once you're like having a more balanced work-life balance and all of that?
So pregnancy is not related to stress.
Okay.
Pregnancy is more of hormones were good during the pregnancy, so hair growth had improved. Then the delivery happens, the body sends all the nutrients to repair the uterus and recover back everything. So then there is something called telogen effluent. So it's a completely reversible, but treatment definitely required.
Okay.
And most importantly is women, when they are prescribed the supplements, they take it for 1 month because post delivery they never go back also to the doctor. They forget their health because the attention is completely on the child, their visits for vaccination, but they forget their but they're lactating till 2 years and not taking supplements, and diet with nuclear family again is becoming poor.
Yeah, ma'am, and like you rightly said, diet has become poor. Plus, if you see again what we were seeing, 15 years ago when we introduced the National Anemia Control Programs, and now we are seeing that in modern population also. Like in cities, most women are iron deficient.
Yes.
And how does that affect, everything in the skin?
If I'm seeing 100 patients of hair fall who are girls, I would say 80 to 90% is because of nutritional. And it is not because food is not available. When that schemes and all were introduced, food poverty was there,
There,
food was
yeah.
not available. Now the food is available, but the eating habits, their pressure, they're in the school for 12 hours, 14 hours. All this is actually leading to the iron deficiency.
Right. Ma'am, and then moving on to, the next big thing in India. Are still people obsessed with skin brightening treatments?
Yes. It is very sad, but yes, it is true. They're behind the fairness. To an extent, I have seen a child who was 4-year-old who was brought by the mother. The mother is daily scrubbing the child
My God.
to brighten. She thinks that if she scrubs the child with basin and a loofah and everything, and with actual skin condition called macular amyloidosis, I have seen a young girl who was earning, say, about 40,000, but investing 50 to 60,000 for IV glutathione injection at skin clinics, beyond taking credits and doing these things. So when I asked her why you are doing this, it's because her mother always said, you are the dark skinned child in the family.
Oh my God, this is really concerning.
Yeah, it is a hard fact. It is still there. And I think we should really, as the medical community and as dermatologists, we should discourage this and talk about healthy skin.
Yeah. So right now, it should also, I think, be spoken that just because you have a fair skin does not mean that you're a healthy skin.
Yes.
Or just because you have a brownish or wheatish skin does not mean you don't have good skin or you're not good looking.
Yeah. Yes, I agree. So that's the healthy skin concept is not there.
Yeah.
Whether it is flawless, but dark wheatish skin, that's our skin type.
Yeah.
We have to own it.
Yeah.
We have to.
Ma'am, and next thing that I see very oftenly is that people have acne in their teenage years, and most people don't know how to manage it. All they're told is just wash, 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 wash.
Yes.
How do you think? And then what will happen is this will create resentment in the future, wherein they have some scarring or open pores, large pores. So how is that to be dealt with?
So puberty onset, even today, the parents understanding it, it's normal. It's okay for them to have it, and it will settle down with the teenage ending. But what they are forgetting is their performance, because they're psychologically impacted because of acne, and that should be taken as a topmost concern and should be treated, is something which is forgotten. The scars, even today, with the best of lasers which we have, we can probably improve it by 70 to 80%, never 100%.
Right.
So prevention is very, very important, and we have wonderful anti-acne medicines which will almost treat the scars also in the initial treatment itself.
Ma'am, and then next moving on to, like you said, lasers and all. Now there are a lot of dermatology clinics which promote pre-wedding laser therapy. You have a party, now you can come get this IV glutathione, this laser therapy, that cleanse, this cleanse. What is your take on it?
And it is the requirement. It is the requirement of the, like a girl who's getting married or a groom who's getting married. It is their inquiries also. They want to look on their, and then it is a huge, wedding is a huge investment. They're spending a lot of money there, so they don't want to give their skincare also. So they're quite safe. The lasers, the procedures are quite safe in the hands of
A
dermatologist, qualified dermatologist, somebody who's trained. But they have to pick their, they have to look at the degrees of whom they are meeting. Otherwise, it's a safe procedure. They can go for it.
How many times can they go for it? Because I have heard of people who get done laser therapies on a monthly basis.
Yeah.
And how often should one do it? And how much is a safer limit?
So laser, when you say, it's a very broad, there are different types. So Q-switch laser, which is for the pigmentation laser which we use, should be cautiously used, like once in 6 weeks is what we call the patient or the client who's getting married. There has been an incident. There is a published paper wherein people went to Thailand, partied, tanned, got the laser done there. The laser was done in like a parlor. It's a very easily available machine, so they have done it. Every week while they were staying, tan, get the laser done. So there was a skin fibrosis which was seen, which was a permanent damage when they have come back. So this can happen. So there is a guidelines which is being provided. It should be followed accordingly.
Okay. Now moving ahead with skin cancer. Most people, now the talk is that if you don't get, now the talk is that, if you don't put on sunscreen, you're going to get skin cancer. How much is it true? Are there been studies that prove that it can cause skin cancer? And what is the truth actually?
Yeah, definitely skin cancer is on a rise. As a private practitioner, I have seen in 2-3 years at least about 2-3 cases of skin cancer. So definitely, which is not a trend our senior dermatologists have seen, there is an increase. Racially, Indians were protected. They were not very prone to skin cancer as
That is because of the increased melanocytes in our skin?
Yeah, melanocytes. Genetically, racially, we were not. But somebody from Australia or the US, they are more prone for it. So they are recommended to go for their mole examination. Mole maps are maintained.
Yeah.
We were not doing that. And so they are very particular. Definitely, sunscreen protects us from skin cancers, and we should do it.
Definitely. Right, ma'am. And, what are some of the most common cases that you see in your clinic on a regular basis where you feel like, oh my God, what have you guys done before coming to me?
Toothpaste application on acne, garlic on alopecia areata. These are aloe vera application that is very, very common, and they burn their skin.
Ma'am, and then next is one very personal skin question is vitiligo. Vitiligo somehow in Indian population is so looked down upon that they try to do anything and everything.
Yes.
Like some people go to Ayurvedic doctors.
Yes.
They do these topical application, cause burns, and sometimes I've seen a relative of mine who has burns with a bubble on it.
Yes.
And the doctor has told them that this is how your skin will change back into a darker skin tone. What is this, and do you see cases? And
Ayurveda or even allopathy, one of the ways to get the color back in vitiligo patch is with photosensitizing. So there are some ingredients which are applied or taken internally, which will go sit into this vitiligo patches, attract the sun rays, and that's why the complication, the blistering which happens. That's a approved treatment, but should be in a very controlled manner. It shouldn't happen that way. The patient should ideally be educated when to stop the treatment, and when there is a mild redness, stop the treatment, and then the blistering shouldn't be happening ideally.
right.
But the social stigma, like you said, they're ready to do anything. They're ready to take. When I tell them these are the side effects of the tablets which I am going to put you on, they're ready to go to any extent, not for themselves. It is for the societal pressure. They have to be accepted. If a young, individual is there, friends are making fun of them or not letting them to be in the group. They are not sharing food with them. A 40-50-year-old wants to treat it because they may not get a prospective groom or a bride for their children. So this societal pressure, stigma still exists.
So I think we as doctors should really work on educating the people that vitiligo is a normal skin condition and it does not spread. A lot of them do not, give them. I find it hard to get married because they believe that vitiligo is a genetic condition. and will move from generation to generation. So what is the real truth about it?
There is a lot of advancement treatment wise. They should take it, and now we are looking at safer treatment which is not giving them side effects. So they should meet dermatologists, take the treatment, and do not combine systems of medicines. They're going to Ayurvedic, then they're going to homeopathic, then they're coming to us. So we really don't have studies wherein we can tell what is the interaction of our drugs with their Ayurvedic. I do not have the knowledge of Ayurvedic. If you want to follow that system, you follow that system of medicine, but don't mix the system of medicine. Do the treatment for yourself, not on the societal pressure. But unfortunately, it is difficult for us to cross this barrier. Even today, they come with photographs of the bride or a groom. We have seen this white spot. Can you tell us this is vitiligo or not? Will my grandchildren have this? Because we are getting a girl married whose parent has a vitiligo. These OPD conversations we are still having.
Yeah. So is it actually true that will a child get it if the parent has it, or it's a chance event?
It's a chance, as much as any other Indian can get it.
Yeah.
As any
So
other.
basically, it's not a genetically transmissible disease.
It is a genetically transmitted, but the risk is very unpredictable.
Okay.
It is as much as the person who's coming and asking me could get vitiligo in comparison to somebody they're getting married in.
Right. So is it safe to say that vitiligo is a normal skin condition, just like how you would have acne?
Yes.
Vitiligo has the same or lesser propensity of appearance.
Yes.
But the main thing is to say that that person does not have to be kind of castrated from the society or kind of looked at it in another way, especially when you're finding a partner. The most important thing would be to look at what actually that partner is bringing into the relationship rather than the appearance.
Appearance, definitely. It's just any other. It's problem of the skin color.
Yeah.
Somebody could be having melasma. That's a pigmentation issue.
Yeah.
Hyperpigmentation. So similarly, this is a loss of color. That's all. So it shouldn't be read beyond this.
Right. And also, want to discuss what are some of the strange requests that you get in your clinic when patients come to you with their asks and wants.
Okay, now this is a very mostly is when they come with skin brightening and color change is one of the commonest requests. Secondly is I want to look like a celebrity or a B celebrity.
Do you still get that request?
They want to have those kind of lips, or they want to have my age is as much as a celebrity's age, but I'm not looking like that. So these are common.
Do people go to any extremes to look like a celebrity?
Yes, there are, but then there is a problem. That's what we call as a body dysmorphism disorders.
Correct.
These are patients who actually require psychological consult. They're never happy. They're worried about that one single freckle on their face, and they're repeatedly coming back. And you do fantastic treatment, still they are unhappy. There are patients who are ready to go to any extent. So I gave you the story of the other girl who was overspending beyond her limits to get the skin.
Right. Ma'am, and next thing is now, previously there used to be this trend in dermatology clinics wherein the husband would bring their wife, or the wife comes to the clinic saying, my husband is not happy because I have this, and hence they're coming. Do you still see that happening today? Or my family is not happy with the way I look?
Yes, with men, yes, we still see that. Many a times or even young teenage boys, the mother is bringing because he's not taking care of the skin, or I am not happy with this particular. But there was a big shift which we saw post COVID. Men started coming with lot of inquiries themselves also.
Okay.
That shift has happened in comparison to pre-COVID.
Yeah.
When they started looking at themselves on the screen, a
Yeah.
lot of work from home started.
Yeah.
We saw many people. I've seen this pigmentation. I'm seeing this wrinkles. I want to treat this. That shift is
So
there.
that is a good shift, in fact,
That's a good shift. They are aware of what is
happening
changes.
to their
So
skin.
many a times they come with pigmentation, and then I have diagnosed them to be diabetics. Their facial acanthosis
Yeah.
then gone unignored. They were sitting at home working for that 2 years, developed acanthosis, and they're coming. So we can pick up serious conditions.
Yeah.
Skin
So
is a
just
mirror.
to simplify, like acanthosis nigricans is what we call is darkness around the
The
neck, and the cheekbones. You have some melasma like kind of pigmentation,
Yes.
and then around your elbows also some people have it.
Temple area also.
Okay. So, ma'am, even now, if you go to a school, you see a lot of kids. Like my cousin itself, he had acanthosis around the neck, obese child. But mother kept denying and only kept scrubbing his neck.
Yes,
Do
scrubbing.
you see that?
Yes. Scrubbing the neck with everything.
Yeah.
Coffee scrubs which are made at home, turmeric packs, basin, and rice flour,
Yeah.
which is very coarse, and they're scrubbing and worsening it.
Huh.
Coffee again, is got into the trend. So whatever coffee powder is there, they're scrubbing their skin off. But then they're failing to understand, and their complete denial when we tell them, yes, you need to put the child into sport.
Yeah.
Even when they come to us, they're in denial. Unless we do take a blood test, show them their insulin levels are on the higher side, then is when the reality check happens.
Ma'am, so how many kids do you actually see who have these hyperinsulinias and very bad obesity problems leading to skin conditions on a regular basis?
Quite an increase, I would say, especially post COVID. The screen time increasing, hardly any interaction, games outside. I would say increased in my practice.
Right. Ma'am, and lastly, I want to actually I want you to give me like a solution as to if somebody has to have healthy skin, good looking skin, what should they be actually doing?
Good lifestyle. So
Okay.
when I say lifestyle to my patients, good food, a high fiber, low protein, low carb diet. Okay. Second thing is a good sleep, good 8 hours of sleep. Good sleeping, which is in the 9 to 5 o'clock,
Okay.
9 p.m. to 5 o'clock. We are seeing them that they sleep at 2 o'clock, wake up at 11,
12.
but your circadian rhythm, biological clock, hormonal disruption, which is happening. Half an hour of exercise to 45 minutes of exercise. If they're open to the fitness training, not just a cardio or walk, but alternate day of fitness training would be another ideal add to their healthy skin. Then the fourth thing is meditation or some form of, when we say self-care, when we are talking about whatever makes them happy. It could be reading a book or going on a trek, hike, whatever makes them happy. This to bring down their stress. These are the four things for their
Okay.
healthy skin. And in the diet, I tell them have this yoga bowl, wherein you put all the raw vegetables, raw fruits which you can add, top it up with your nuts and chia seeds and flax seeds. Replace one meal with this bowl. Is especially your dinner, if you can replace it with this kind of a meal, is a good gut, good skin.
Right. And the second thing I want to ask you is now there's a great, since you said diet, there's a great increase in the consumption of whey protein. And then there is all different kinds of protein. Now there is whey, there is plant-based protein and all of that.
Whey isolates.
Whey isolates and all of that. Should people be taking these? What does it do to the skin? And who should be taking, who should not be taking it?
So definitely whey protein works by increasing your insulin-like growth factor. So the muscle has to build, then it has to release some hormone. So that is the insulin growth factor. whatever condition which gets worse with this insulin growth factors are going to get worse, like acne, male pattern hair loss. This is going to get worse. The second thing is the unchecked market. What the whey protein actually has, whether they have added some steroids to it, whether that check is not there, the reliability of the sources. This is a second problem. So we see frank, whoever are on whey protein, this whey isolate, we see them with frank steroid changes, monomorphic pimple, blackheads, comedones on their skin, hair loss which is worsening. So this is to be taken with lot of caution.
Right.
As much as possible, your natural sources of protein is ideal.
Understood. Ma'am, and the last thing is there is a lot of dermatologist approved products ads on Instagram. You see it on TikTok. And what is your take on these things? Like, should dermatologists actually be promoting these things on a general basis, or how should it be done actually?
So there is going to be a major, they're going to come down on this. There is a guidelines which is already been provided to us, and from again Indian Association of Dermatologists, what is okay, whether taking the brand names is okay or not, how much information to be provided. So there are guidelines which has been, so it's going to get more streamlined when the law is going to come down on it. But the other thing were derm certified products. So whenever the researcher, when they have to bring out a molecule, yes, pharmacologist should be there, and similarly a dermatologist. A post-market surveillance which is done, like a company comes out with a product, then they're going to give it to us initially, and then we give them a feedback how it is working in comparison to A and B. That kind of a research also. Then if you're saying it is a derm certified product, it's legitimate.
Okay, understood. Ma'am, and another very weird question is that since we spoke about colorism, why do still a lot of clinics, still promote skin brightening treatments? And, shouldn't it be that, the dermatologists as a, ethical procedure
Yes.
take a, stand on this, that, this is not something we should promote? Is that, a thing? And why do they still promote these skin brightening treatments? And
I think skin lightening and skin brightening, these are two different terminologies. Skin lightening is you are changing the person's color.
correct.
That is ethically wrong. But skin brightening, somebody has a tan and then you want to brighten up the skin.
Right.
That's a right terminology and an approved treatment. It is okay. But wherein you're encouraging skin lightening, then that is ethically
Right.
wrong, I would say. But many people are doing. I would stand up and say for all the dermatologists, I don't think they are doing it. But for the other quacks who are practicing, it's a revenue generation. They're making money out of it.
Right.
So they're what products they're using, what they're injecting.
Yeah.
People have to be really aware.
Right. Ma'am, and then moving towards, now, you said a lot of quacks practicing and all of that. We're seeing that in all kinds of medical streams and all of it. And it is our responsibility to educate the patient to look for the right things. That is like become a very big, major thing in the medical field right now. But apart from that, are you also seeing an increase in treatments of Botox and, fillers and various other, colloid treatments, or, some collagen synthesis treatments? All of that, is that increased now?
Yeah, increase. People are aware. People are aware that they can get Botox done. They can do fillers, skin lifting, skin tightening. And they are aware, and there is definitely an increase demand which is there.
Right. And is there any bad side effect to this?
Uh, there are side effects. It's a treatment.
Yeah.
It has to be under the supervision. Botox is a injection which is to relax. And Botox is a brand name. Botulinum toxin is the ingredient. It is to relax the muscle.
Yeah.
So there are adverse events which can happen. That's why it has to be done by a professional, like a
Right.
surgery. If it is done, it has to be done in the right setup and right person. But it's also at the same time, it is being made as safe as possible by the manufacturers, and we take the precautions where to inject, where not to inject, with the right anatomy knowledge. So patients shouldn't fear, but they should be aware. They
Right.
should be informed about what are the problems.
Ma'am, and now regarding that recent news of hair transplant gone wrong and the patient has actually died, what is your take on it? How should patients be aware when picking such kind of a clinic to do such kind of a procedure?
So it has to be a setup which is well equipped for the complications also. In any local anesthesia, you're giving anything involved, whether the backup of the emergency services are there. Is the clinic attached to some hospital wherein they can rush immediately, can be shifted? And there are guidelines, the governmental guidelines which are being there. But the periodic check to bring down which are not for doing it
Should
is
be there.
should be more stringent, which I would
Right.
say.
Thank you, ma'am. So we have had like a great in-depth conversation about, skin health and how should one take care of it and what are the things to do and to not do, basically educating people about it. I think we've had like a great conversation with you and, would like to hear more from you as to how more people can become aware of their skin.
Thank you. I mean, it was very great initiative from you. I have to tell you how people are aware is I had a patient whose relative was in US. The person sitting in US actually checked my MCI registration number, then told his sister that you can go to her because she's a certified
Yeah.
dermatologist. So people should actually be doing that. I
Yeah.
think I want to use this platform to reach out to people,
Yeah.
to say that do your
Research.
find out the genuine doctors, meet them.
Yeah.
You have everything at just a click away on your
Yeah.
phones. They should be doing that and not meeting anybody.
Yeah.
There have been huge fines wherein the people who have, they're not even actual doctors which
Yeah.
have been brought down.
Thank you so much, ma'am.